our staff members who return to work during breastfeeding are able to have a safe oasis. They can produce milk. It's right adjacent to the pediatrics ward. It can be safely stored so that this can be administered while they work and so that breast not interrupted. So, as we have said, we have been on a journey, and accreditation has been a big part of our focus, but we're not done yet. We are not finished. We continue to have great aspirations. This is a part of our vision, and it is our desire that Mandeville Regional Hospital will continue to evolve into a state-of-the-art maternity unit. We will continue to improve the infrastructure, the equipment, and the manpower with your help, because we know that we can depend on all of you, our well-wishers, partners, and stakeholders to support us in this effort. So, we dotted every I, we crossed every T, and we thought we had it all put together. So in January 2020, we launched an event that we called the We Ready MRH Buzz event. And this was just before we were to be accredited. That was in 2020. And you know what was happening in 2020? In 2020. We thought that we were just going to be accredited and this whole ceremony would have been happening, and then came COVID-19. Oh my goodness. COVID-19 came and it felt as if everything just, I literally cried. It felt as if the whole world had just fallen apart at the seams. As a hospital, as a department, as frontline workers, as parents, as children, it seemed as if it was all we could do to keep our patients safe, to keep our colleagues safe, to keep our families safe. But it is fortunate that the seeds that we had sown were good seeds. And even during the pandemic, we continued teaching because the principals, women were still having babies, mothers were still having babies, and babies still needed breast milk. So even when we got dislocated and we had to move our postnatal ward and everything got shifted around, we continued doing what we were doing and we continued training. And Sister Leakey safeguarded all our critical documents through what seems like tumultuous changes. And so, when the call came in April of 2022, Mandeville Regional Hospital, you're ready? We answered with confidence, yes, we're ready. We were assessed, and as you have heard, it is a rigorous process with the evaluation of mothers, the interview of parents, the evaluation of our physical plant, the scrutiny of our documents, and we were successful. And after 16 long years, we heard the words that we had yearned for, worked for, and longed for. Mandeville Regional Hospital approved for BFHI accreditation. We are beyond proud. We are beyond proud. We have no words to encapsulate this occasion and this achievement, and we thank you all so much for coming to share it with us and for being excited with us. But our word is this: we did it. And to my sister hospitals in Southern Region Health Authority and my sister hospitals across Jamaica, we did it, and you can do it too. Remember, unity is key. If you can't do it, if you can't find it, build it. Your solutions may not be the same as ours. And last but by no means least, BFHI is more than an accreditation. It is a commitment to excellent patient care. Thank you.
This has indeed been a journey, wasn't it? But we agree that breastfeeding is a responsibility. It is not a choice. And as Dr. Gray Henry said, for our sister facilities, we are available to provide support in terms of best practices and whatever it is that we can do to help you to achieve this milestone. We are now at the presentations of awards. As you would have realized from Dr. Henry's presentation, several persons have assisted, has worked alongside the team on this journey. So the Mandeville Regional Hospital BFHI Committee consists of trainers, heads of department, support staff. Some persons have been on the journey with us for the 16 years, and so we want to acknowledge them. I'll ask Mr. Michael Bent, Regional Director, to assist with the presentation of the awards. Katie Ann Brown. Katie Ann Brown. Odine Kennedy. Okay, all right. Kadeen Simpson, Dalton Mary, Rowan Smith, in that order. Thank you, Mr. Bent. I'll invite Honorable Mrs. Juliet Cuthbert-Flynn to continue with the presentations. Alice Carney, Denzel Williams, Marie Cohen, Laurie Stabano, Jacqueline Leakey. Denzel Williams, Marie Cohen, Laurie Stabano, Jacqueline Leakey. Alice Carney, Denzel Williams, Marie Cohen, Laurie Stabano, Jacqueline Leakey. Thank you, Mrs. Cuthbert-Flynn. Marie, oh, one is left. Overlook you. Marie, it took so long to come. I'll ask Dr. Carissa Etienne to assist with the presentations here. Marie Cohen, Jacqueline Leakey, Ethan Thompson, Shani Fletcher Groves. Sorry? Sister, where were the two of you? Jacqueline Leakey, Laurie Stabano, Ethan Thompson and Shani Fletcher Groves. Thank you, Dr. Etienne. Miss Mariko Kagoshima. Donna Marie Gray Henry. Dr. Everton McIntosh. Miss Marcia Francis. Mr. Alwyn Miller. Thank you, Ms. Mariko Kagoshima. Honorable Dr. Christopher Tufton. Dr. Esmin Dodd Lewis. She has been on that journey with the Mandeville Regional Hospital for what? Oh, she started the journey 16 years ago. Please stand and cheer her. Mrs. Sadie, thank you, Mrs. Sadie Williams Allen. Thank you, Dr. Tufton. That's the end of the presentations. As you know, we have celebrating with us today Dr. Carissa Etienne. Dr. Carissa Etienne is Dominican born. She is a public health expert who serves as the director of the Pan American Health Organization, and she is the regional director for the Americas for the World Health Organization as from 2018 to 2023. She is currently in her second 5-year term as PAHO Director, having been re-elected by PAHO member states during the Pan Am Sanitary Conference in 2017. In January 2018, Dr. Etienne was named Regional Director for the Americas for the World Health Organization by its Executive Board based in Geneva. Dr. Etienne is a graduate of the University of the West Indies, Jamaica. She earned her degree on medicine and surgery, followed by her master's degree in community health from the London School of Hygiene and Tropical Medicine. Her career began as a medical officer at Dominica's Princess Margaret Hospital, where she was Director of Primary Health Care Services, among other top-level positions, culminating in her serving for 2 terms as Chief Medical Officer in the Ministry of Health. Dr. Etienne has given human service to PAHO and the World Health Organization in various positions from 2008 as Assistant Director to 2013. She also serves as Honorary Vice President of the American Public Health Association. Ladies and gentlemen, our guest speaker can also be credited for successfully leading our region's preparedness and response effort to the Zika and chikungunya epidemics, as well as the cholera and yellow fever outbreak in Haiti. Time will not permit me to adequately chronicle her remarkable career accomplishments to date, and I am sure you are eager to hear from her today. So please join me as I welcome Dr. Carissa Etienne to address us. Dr. Etienne.
Thank you and good morning. Let me begin by thanking you for having me among your midst. I have one thing to say, you're liquor, but you're talent. Let me greet Minister of Health, Dr. the Honorable Christopher Tufton, Minister of State in the Ministry of Health and Wellness, Mrs. Cuthbert Lean, the Costus Honorable Rotolorum, Mr. Garfield Green, Mandeville Hospital CEO, Mr. Alwyn Miller, Regional Director, Mr. Michael Bent, Senior Medical Officer, Dr. Everton McIntosh, our UNICEF sister agency representative, Mariko Kagoshima, our Director of Nursing. Let me also say, I greet all the functionaries of the Ministry of Health, the Mandeville Regional Hospital, and the Southern Regional Health Authority. I am indeed happy to be here with you, and I've listened as you've chronicled that journey of 16 years. And yes, the longest journey starts with a first step. And my congratulations to all of you who took that first step. And this is a tremendous achievement. This Baby-Friendly Hospital Initiative is a global initiative. And what we are noticing is that there has been some fall off in terms of the enthusiasm with which people are engaging in ensuring baby-friendly hospitals. But like you, we know that it is important for the health of the baby. It is important for the health of the mother. It is important for our health as communities. And because one of the greatest causes of our mortality, the non-communicable diseases, breastfeeding helps to fight this, both for the child and for the mother. So my sincere congratulations on having attained this milestone, a milestone that is not easy to come by. But as I listen to you, Dr. Gray, right, as I listen to you, Dr. Gray, and your presentation, and congratulations for this presentation, I began to think that this team approach that you have led within your journey, I hope that this also materializes in the rest of the work that you have to do. That as you, healthcare workers at the hospital, in the community, as you have worked with your cleaners, as you have worked with your various ancillary staff, your nursing staff, and your medical staff, that you have built a commitment to team approach. Because this is one of the things that we require. And maybe this is one of the side impacts as well of the Baby Friendly Hospital Initiative, that you would have built team. But as well, that you would have built the desire, the quest for excellence. Because this is what also the Baby Friendly Health Initiative seeks to develop, excellence. And as we face this new era post COVID-19, well, not post yet, but certainly as we look into the transition, excellence is going to be important. It is going to be important that as we look towards resilient health systems, that quality of care will be central to the services that we will give to our peoples. We believe, I have a little competition, we have big mouths, so don't bother with that. I believe, and the World Health Organization and the Pan American Health Organization, we believe that health, access to quality, comprehensive health is a right of any human being. Mr. Honorable Tufton is clapping, but we also believe that it is the government's responsibility to make sure that the necessary investments are made and the leadership is given to ensuring good health for all, good health and well-being. And health is about health. It's not about illness. And so as we refocus the work that we need to do, we need to begin to focus, how do we make people more healthy? How do we prevent illness? How do we promote health? And breastfeeding is one of those health promotion mechanisms and a preventive mechanism as well. So as we move forward, let me again thank Minister Tufton, the Ministry of Health, and the government of Jamaica for the investments that they continue to make in your health system. Financing a health system for a community and for a population as you have is not necessarily an easy thing. Especially when you have so many competing priorities, especially when you are facing economic issues. And with the advent of the pandemic, many of our countries in the region are facing economic crisis, are facing fiscal deficits and weakness. But I continue to see the commitment of Minister Tufton and his team at the Ministry of Health, your Minister of Finance, to invest in health. And so it really is each of your responsibility to ensure that you build efficiency into the work that you do, because every dollar that we save is a dollar that we can put towards health and well-being. And so each of us has this responsibility to build health. And that is why the work that you've done in the Baby Friendly Hospital Initiative is so important. You have taken personal and team responsibility for the health of children and the health of women, and these are some of the most vulnerable persons in our populations. So PAHO has been happy to accompany you on this journey. It's been a long journey, and like you, we also lament the fact that why are they not doing this? Why, and how can we help them to better achieve? And so my wish is that you will spark off an interest not only in the Southern Regional Health Authority, but you will spark a new interest across this country of Jamaica. That's loud and clear that the population, healthcare workers, hospitals will hear that yes, it can be done. That because we did it, we know that you can do it. And I've also noted that you have offered to work with them as well and to help them in